Now is the time I thought in my mind, the people who are really wanted to learn, since we do have the ample time to diagnose the patients. But if we will give this in the last moment, that particular time you have very less time in order to see to the number of the, not the patients, of course you can see to the in your home itself or wherever the people are connecting to you and that you are studying, then keep learning and then keep learning in order to understand the pulse diagnosis. The authors or masters says that it is very super simple. At the same time, it takes decades together to become the expert in the pulse diagnosis. But across the globe, if I am not wrong, in fact, no one is expert in the pulse diagnosis, but it is not I am giving you is the negative signal to all of you, but of course is the very positivity. But in fact, there are the 28 pulses types are existing. There are the 32 different types of the pulses are existing according to the some of the authors. But in fact is the learning to all the types of the pulses is not the cup of the tea. But at the same time it's not impossible as well. In my 2 decades experience, certainly that will going to come executing now, that what could be the shortest ways to understand. Because you understand there are the numerous pathways to achieve our destination and goals. Right? In this way, when you wanted to understand in the subtle ways, shortest ways, not to make you as a complication, in the super simple level how we understand the pulse is the key. For that we try to understand how we can understand about the various types of the pulses. But however, if we wanted to learn this art of science, to get the accuracy of the kind of the diseases, existing diseases, previous diseases and upcoming diseases, we can predict some of the diseases as well during these procedures. But in fact, now you can see around 80% of the diseases we can reach that without any examinations. We all know there is a pulmoscopy, blood investigations, and further there is a skyotype of the skyography, or the we call as a X-ray machines. Sonography is ultrasound scannings, right? MRI scans, CT scans, PET scans. Of course, I respect all the system of the investigations. At the same time, we can reach to the non-invasive modality and inexpensive modality of the diagnosis is the very super simple and economical way that we can understand about the etiology, pathogenesis and then onset of the actions to understand about the diseases. In fact, how amazing is it, you understand, the people who completed every system of the medicine, every system of the treatment, honestly I am telling you, there is a each and every system, shortest way there is the etiology and pathogenesis. What is the causative factor to cause the diseases? every system they do have, but no one is in this scenario, they are not incorporating to do that. There is a different pains are there. That pain how you identify. There is a shortest way. For example, shoulder pain is there. If the right shoulder pain is there, that something is different from the left shoulder pain. If the left shoulder pain is there, you just ask them, the diabetes patient, they do have that pain in generally. Otherwise, you just give the pressure below the chest cavity. Once you give the pressure on this region, the patient feels the pain. So that also indicating is the shoulder pain. That's called as a care sign. No doubt, the shoulder joint is the complex joint in our body, which having the 4 joints for the shoulder. Which shoulder having the pain, which shoulder joint creating the pain, we need to analyze, of course, by doing the various modalities. When we understand about the which joint, then treatment also good. But however, so there are the sign and symptom, adduction, abduction, right, extension, flexion, all gets matters. So that also connected to understand, yes, this could be the reason. So there's away from the center of the navel and then four fingers distal. So there is a sign. In this particular spot, if you have the pain, and then chances are there to cause the appendicitis, perhaps that is there is appendicitis itself. So we do have the point in our body that's called as a Lan V, right? So Lan V is indicating that is a vermiform appendix in Chinese. So you just give the pressure where that point is located. Wonderful.
Next to the navel. And
Next to the?
navel.
Yes.
Fortune.
No, this is in fact Tu Chun distal to the Su San Li. Stomach 36 on the stomach meridian. But 3 Chun distal to stomach 36, there is the Shang Chuk Su. Shang means is the big, Chuk Su means is intestine. Right? So midway between this stomach 36 and then stomach 37, between that on the 1 finger breadth, the lateral border of the tibia, you will get the tenderness spot on that region. So that indicating it's a very acute and excruciating pain on that region while giving the pressure, that indicating there is a appendicitis, inflammation of the appendix. So when there is no pain, but the pain is in this region on the right iliac fossa, pain is there to patient. When he don't have the pain on the appendix region of the Lan V on the stomach 36 below that, then we do need not to consider that itself is the appendix. This is the primary identification to understand. So in the similar way, numerous modalities are there to understand with any system of the medicine, whereas we are not doing all those things. But here during the pulse diagnosis, in fact, so really I am very happy that most of the people comes to us. Normally I don't want to ask to the patient. This my heart is telling you, not by mouth. When the patient comes to us, I don't like to tell their problem to me. Let I identify, then only I will become expert. So therefore, I understand nearly 80% of the conditions most of the time. Perhaps sometimes I may be loose or I may be failure also. But most of the times, about if I can see 100 patients, 20 patients I cannot tell, but 80% of the patients I can predict what there is, they do have the problem, And certainly that the people says, most of the people, sir मुझे बोलने का कुछ भी नहीं है, I told everything, you only told everything, which including their respective emotions, including there is the physical illness, including there is a skeletal system, including the anatomy, physiology, pathophysiology, all to be taken place once we understand the pulse diagnosis. In fact, that's the key. If the medical doctor, they study for the 5 years plus 3 years is the 8 years, then you understand they are totally dependent on the investigations only. That will be the problem, right? That will be the problem, isn't it? So it's not like that. Every time we do require the investigation, of course, which I don't like it. So when we are the expert, if see, in between you and then patient, there is no machineries. There is no like a MRI, CT, stethoscope or something is a blood pressure monitor and X-ray monitor. Nothing they do have. We do have. In this case, how we can make them to understand, to gain the confidence on you. Once you tell their complaints and then problems, then there will be faith on you to take the entire course of the treatment. Remember, I am telling you, if the patient is coming to us with their psychology in order to get the relief of the patient, but we are thinking in our own modality, we are the supreme medicine acupuncture, but here is we are thinking in that level, the patient is not thinking that level, then it gets the mismatch. When there is a mismatch, then you understand the patient doesn't come here to take the treatment. That is, make sure. You want it to be like that as a gain the confidence. So now we understand up to, as I told you, is the 80%. During the pregnancy, the amount of the blood is pumped by the heart, cardiac output increases around the 30 to 50%. As the cardiac output, the heart rate speeds up to 90 beats per minute. In fact, this is as per the Drug and Cosmetic Act 1940. There is the Drug Termination, Pregnancy Termination Act is there. So that act is not giving the permission to tell the sex of the fetus. So by keeping that respect in my mind, so even we can predict most of the pregnancies, whether it is the positive, that means is the male or the female sex. But we don't want to tell. But we also can understand there is all the parameters are good, and then that increasing, that the beats are increased, that particular situation where the mother heart is pumping more than 30 to 50% increases in order to supply to the infant, fetus. So therefore we also predict around maximum, if it is the right side, the pulses, normally the right side pulses are more pop up, prominent, that indicating the female baby. When the left hand pulses are very dominant, then the right side, that indicating the male baby. Right? So therefore, when we understand about, we wanted to know that when the patient is simply coming that says that I don't have the cycles, and I didn't get the cycles for the last 2 months, and the age of 30 years, at the age of less than 40 years or 45 years, and we try to understand whether they don't have that. For the last couple of years they were trying that there is no children, or there are some expectations, yes, I don't get any pregnancy positive. Perhaps they have the coitus. There are the numerous methods. If during the pregnancy, or if we do have the children, but again they are joining together doing the coitus or the intercourse, so that particular time the people is not aware, yes, I am doing in the safe period. Safe period doing the coitus is safe only. Ovulation taken place maximum 48 hours in 28 days, right? Another period during the menstruation, it is strongly prohibited doing the coitus, and however will get 20 days. In that 20 days, 2 hours only is the peak ovulation time between 13th to 15th day of the cycle. So that particular time you just skip away. If they are assuming that it is safe, then they are meeting on the 16th day, they say it's normal and we can have the sex. So perhaps some of the women having the ovulation on 15th day according to their respective cycles. I think I have done the infertility one video itself, when is the safe, when is the unsafe, and when the ovulation period especially. So I think you people can watch that. So in this case now we understand.
Is it in YouTube, sir?
Yes. So now we wanted to see that if the rapid level of the pulses is going on during they don't have the expectation I am positive, but we predict that perhaps you can check the pregnancy. We can put a word whether you want the children or you want the child. You can see it. So if you don't want, and we don't have the termination, and in fact once after the marriage there is the positive is there, pregnancy gravidex positive is there, that particular time make sure, and we shouldn't do the termination. Whether we do have the 4 children and the 5th children I don't want, and we wanted to go for the termination, in fact that's not permittable, but that will be answerable in our last destination, especially in the after our death. There is a question why that child is asking you, so why did you done the murder for me? We are doing something directly, indirectly, that is a great sin. So Almighty should forgive for all of us if we have done the mistake on it, knowingly, unknowingly, because that's really not good, right? Whatever, at the same time we believe that if the child is coming to this universe, that the child is getting from the birth to till death, the entire food is they are getting exactly. So we are just as a pathways to nourish them, but Almighty has written their destination for me, for him, for you, and everybody, how much food to be required and how many breath to be taken, not the years. Last breath is the last breath. I have written that already. So we should be keeping that intention in our mind, based on that, without doing much sin, and how we can do the survival in the natural form. However, by the way, you understand, this is the pregnancy also can be predicted by pulse diagnosis as well. Now, the ancient Vedic pulse diagnosis system, in fact, according to the traditional medicine, there are the 5 super organs in our body which works continuously. We all know the lungs and then cardiac system together. It's functioning continuously in our body from the birth till last breath. It never stops. How amazing Almighty created this. So therefore, that both the organs are dominating to produce the blood and to promote the blood in the form of the chi. When the spleen is there, so that spleen is very, very crucial, of course, in order to produce the blood as well in the form of the post essence chi, or the post essence or the acquired energy, and through that the blood is produces, and also spleen having the quality to control the blood also. When the people have the lot of menstruation, that means is the regular menstruation, or the menstruation is not stopping on time, and that means more than 10 days is bleeding is happening, but the whole month they have taken as a sattvic food, and they have extracted so much food in terms of the forming the energy and then blood in the body, so that will be vanishing through the menstruation. Of course, the energy has been drained out. But make sure that spleen is good, then your blood also controls timely. The menstruation is the God gift to all the women from the monarch puberty to the menopause. That should be happen every 28 days except during the pregnancies. So therefore, now we understand spleen is the crucial. Of course, the other one is the liver. So liver also having the major role. Whatever as the post essence energy we eat and drink liquids, then that to be extracted in the form of the energy that will be stored in liver. That once will stored in the liver, that liver is scattering and then distributing the energy to all the organ. You remember that it is related to the uterus, but uterus is governing by the liver as well. Uterus is governing by the liver. So when the liver menstruation dysmenorrhea is there, dysmenorrhea is the primary and then secondary, both are different. So in the PMS, pre-menstruation syndrome is there. So all are connected to the not only the uterus and then bladder or the para-orb of the pelvis, it is also connected to the liver, which causing you the pain on the lower abdomen as well. So therefore, there is the bleeding is not happening. That also could be the reason where the liver storage capacity is lesser than that amount. So which causing the problem in the menstruation. The menstruation is the reason is not only it's related to the bladder and then ovaries and then uterus, but it also connected to the liver indirectly according to the TCM. So therefore, now we understand about the liver and then kidneys. Kidneys storage is the essence. The essence is something is unique and then different, where we call as a one drop of the essence, you are and I am in this whole world. That's nothing but is the ovum, egg, semen, sperm. This is the great essence transformed into the blood, right? So therefore, all these 5 organs are very, very imperative in order to blood flow inside the blood vessels. If the blood is poor, the circulation is poor. When the circulation is poor, that reflecting on the artery also poor. What is pulse? Expansion and contraction of the blood vessels, and also movement of the blood inside the arteries, that's called as a pulse. When that gets the changes in the diameter of the vessel, that causes the problem where the visceral artery having the problem, where the blood properly is not flowing inside the blood vessels or the arteries in respective of the organ, that reflect on the radial artery. Radial artery, there are the few arteries, numerous arteries are there, among them very few arteries, so which is executing on the skin surface level. That one among them is the radial artery. Right? So therefore, the blood vessels we wanted to keep it precisely, then what to be required? All the 5 Zhang viscera is very, very crucial to regulate the system. Lungs are good, heart is good, then the circulation also good. Spleen is good, then the promotion also good. When the liver is good, distribution also good. Then the kidney is good. From there the essence is transformed into the blood. Then blood purification also to be taken place through the renal system. If these parameters are good, the cholesterol and then whatever is the alkalides we call as a lipid profile and a liver function test. So this is in fact is good. Then the flow also good. We call as a hyperlipidemia, which the excessive cholesterol is deposited, which calls atherosclerosis. That means is the deposition of the fat inside the blood vessels. So this in fact is the obstruction. So that obstruction shouldn't happen, and over the period of time that will happen at the age of about 50 years, 60 years, 70 years, we don't know. But these days, so Almighty save to everyone, and the people are prone to get the cardiac problems are soon. That means are affected. So where is the mistake? For me and for you to, for everyone to identify where is the causative factors, right? In this way you understand, overall I understand is the 3 concepts, keep it in our mind. One is the first thing is we have to do as some exercises, physical exercises is very must at the time of the wake up, in terms of the meditation, so on. The second thing is, of course, the intake of the food. Are you taking precisely food? The third one is, of course, is our thought process, our emotions, our evils. If 3 concepts are good, then certainly we do have the great impact to get the happy and blissful life and then healthy life as well. Right? Now we understand about the significance of the pulse diagnosis, as well about the pulse diagnosis. However, we try to understand about the what are the importance of the pulse diagnosis, why is it so required. There is the exterior and interior diseases to recognize. What are the exterior diseases? What is the interior? We all know exterior, that time it gets changes of the external manifestation of the body in terms of the acute problems of the cold, congestion, fever, cough, body pain timely, and fatigueness, right? Red face, swelling, sometimes is the mild joint pain, so on. When there is the interior syndromes, now we try to identify 2 different concepts here. Exterior because of the external pathogenic factors. The interior syndromes related to the in viscera is affected. What are those? Interior syndromes, diseases is related to the spleen, heart, lungs, kidney and liver. Of course, sometimes brain as well. This is called as the interior problems, right? So this we identify what could be the reason. So this I will explain you. If it is the deficiency and then excessiveness. Apart from this exterior, I tell you, all the exterior syndromes are connected to the fu viscera. That means once you place the finger on the radial artery, the patient feel that there is some kind of the imbalances where you can feel that pulse is hyperpulse or the pulse is empty pulse. Once we place, so we feel that the pulse is very pop-up, so very forceful, and it's a normal, above the normal level. So that time How to identify this? Rhythm, force, tension, quality, volume, all are dependent. So therefore you understand, once you place that, if it is quite normal, that indicating that's normal. If it is weak, that means is the deficiency of the fu viscera, or sometimes is the hyper of the that force, that to be considered as a, this is the excessive of the pulse because of the external pathogenic factor which causing the problem. Then come to the next level. This is the deficiency or the excessiveness. We try to predict that through the pulse analysis. Now we understand, place the finger on the artery. Then we try to find out there is the pulse is there, that to be normal. So how to identify this? So when you understand 60 to 90 beats per minute is to be considered as a normal, we keep checking to the all the people who are around us to understand about the rhythm of the pulse. There is a piano is there. In that piano where the key need to be placed, that's very important. In that way you learn this is kind of the piano. Right. Now we understand there is an interior disease is there that connected to the Zhang viscera. That means is the indiseases. For example, you just see the diabetes mellitus, there is a thyroid related issues and hypertension, and then cancer related conditions, of course the other chronic diseases. So all are connected to the in viscera. In viscera is indicating, in means it works continuously, and then yang viscera which works intermittently. Right? Stomach works intermittently, small intestine, large intestine works intermittently. If it works continuously, what happens? We always should sit in the kitchen or in the bathroom, washroom. Right? So which one you want it to be, you just see, if you want it to work continuously. Right? So therefore it is very, very crucial that always is the yin syndromes are connected to the interior diseases, and yang diseases are existing for the exterior diseases. Now we understand the ascertain the nature of the disease. So the nature is the cold nature or the hot nature of the disease. The entire spectrum of the diseases, most of the time we analyze and understand. You just place the hand anywhere on the body, especially on the where the affected area. If there is a cervical pain is there or the shoulder pain is there, that particular time ask them to just open the area of the pain and then place the finger after few minutes. If there is everything is protected, so that time open, that time it shows like a heart or heat is there. But real nature to understand in the room temperature, so that particular time after few minutes you try to touch and feel. If the patient is normal and the temperature is comparatively normal, then try to understand which meridian is affected, which pulse is showing the pathology, that pulse to be activated or that meridian to be activated. When there is the hot nature is there, that means hotness is there, that particular time, that vicinity of the meridians or the hot nature, we need to drain out by using the blood lenting modalities. You just take the one drop of the blood on that meridian. Which meridian? It shows that if the pain is on the acromion process, then the large intestine meridian is affected, very hardness. Then the draining out of the Shang Yang Li1 point, that is the solution. If there is a due to some trauma or injury, there is a inflammation or the heavy, especially on the teres minor muscles, pain in this region, there is a hotness is there, that is small intestine having the excessive energy. Through the pulse also you can analyze that. At the same time solution also, we need to drain one particular point, that SI1 bleeding, that will be helpful to come out that which that meridian having the excessive hotness or heat affected on that vicinity of the shoulder, drain out that. Isn't it? So there is a solution. When the nature is not on the hotness, of course hotness also is there. Another modality is applying the ice on that application of the affected area. Especially in the night time, you just apply the ice for the shoulder pain and the patient feel drastically changes and he'll get the sound sleep as well. So therefore, when there is the cryopuncture, that's called as a ice application itself is a device, it will come. So that device is, there is a ice water is there inside, and then place it on the shoulder. That will be awesome to get the relief as well. Now you understand the energy we should, the yin is a deficiency, yang is deficiency, yin is excessiveness in this particular region. That particular time we just activate as much as possible yang to be more activation to that particular point. Of course the huxi, chungsu. So these points are Sanjo 3, SI 3 and LI 3. These are the 3 points are really good to treat for the shoulder brachial syndromes. Regularly activating these 3 points and the patient feel lot of changes by activating the shoulder pain. But when it's required, the yang is more, yang is required to promote. That means the hot application is good for them, then these 3 points are good. When the cold application is good for them, then all the different points to be activated. One is the Shang Yang, second one is the Shaoza, third one is Quan Chung. That is Li 1, Sanjo 1, Si 1. This to be bleeded. So to understand about the nature of the disease, how to touch and palpate to understand about the constitution of the disease, and the same time to inspect the disease of the mechanism and to predict the diseases and prognosis. When we understand, we place the finger that particular time. When there is a large intestine pulse, you are placing that, and we can feel that pulse normal, it's normal. When the large intestine pulse we are not feeling. I'll show you where the large intestine pulse and other pulse will do the practical certainly. So that particular moment we just place it. If it is no pulse, right, that is the vacuity of the pulse, large intestine, or the empty of the pulse, or the deficiency of the large intestine. Deficiency. So due to deficiency of the large intestine, chances are there to get the numerous related diseases as well, which causing you the headache, which causing you the back pain, which causing you the GIT related problem. Of course, due to that reason, the lungs also affected. Skin related issues as well. Then you understand the large intestine pulse is pop-upping. It is a very hammering like that. It's a very forcefully. It is affecting on the pulse. So that indicating pulse is retention of the unwanted morbidity, toxicity or the turbidity inside the colon, which reflecting here, we understand there is a retention in your colon. Most of the people, some people who have the constipation, they says I don't have the constipation, by the way I go 3 days once for the stool passing. How is it funny? But they don't take it to their mind, I do have the constipation, but the 3 times they eat normally, but at the same time they pass the stool for 2 days minimum, or 3 days, 4 days, 5 days, 6 days. I heard about 1 or 2 patients, I go 7 days once also. What happened? So that particular time the large intestine pulse shows is the hyper. So that hyper indicating, so we predict that there is a turbidity in your colon. Yes or no? There is a accumulation. What to be done? Open the rectum to pass the stool? Sometimes the people do that, putting fingers and eliminating, so on. The people who have the constipated, you ask how is the problem, is the beauty of the problem, or there is the miscellaneous of the problem. That means is the very, very great problem. The constipation is the root cause for the known and unknown diseases.
You are telling about only the normal people or the old age people also?
All the people, including the children, they too have the constipation. By birth they do have the habitual constipation, some of the children. So that particular time we can say that you are constipated. That says that no, I don't have constipation, because they are not taken to their mind itself. You understand every day twice should pass the stool. Morning 6 a.m., evening 6 p.m. If it is one time, that also not bad. That's a good. You understand the person who maintained the weight around at the age of 30 years, grown up to that level, and then till 70 years, 80 years, as much his age, he can maintain around 1 kg, 2 kg, 3 kgs, 4 kgs, okay, over the period of time. He can maintain to that normal level, that he is healthiest person, because the intake he is taking the food, at the same time the extracted the energy in the form of the chi, the remaining the turbidity to pass through the stool. Kitna intake, that much is output as well. So therefore you understand there is the ingoing and outgoing, both are good, then you are healthy. So what I mean to say, we can predict the diseases as well. So most of the time the patient says if the large intestine pulse is excessiveness, then you understand the headache causing the problem. The patient is biggest liar is, I know that, patient only. So he says that no sir, I don't get headache. So rarely I'll get, one monthly once I'll get, or 3 months once I get headache. But if you ask like that, so if he says that, so every day I'm not getting, but I'm getting monthly once only. But I'm asking, do you get headache? He says no. So we can, perhaps he's coming, okay. He is not telling, since we also liar, right? Sometimes I'm the patient, I'm also liar. If you are the patient, you also liar. Very less people says that, yes, everything is openly. Right? So many funny things people are there. So I wanted to share sometimes, but it's not the place. Sometimes we upload, that will be the problem. But however, the thing is, if I told you is the predict. So if the large intestine having the pop-up, excessive energy, and the patient really they don't have the headache, and certainly they do get the headache as well. Because the glabella, the frontal head is regulated by the large intestine, that means is the yang ming stomach and then large intestine. Both are the reason to cause the pain on this region. Do you have the headache? Says no. Then this I have the experience. Sir, you was asking on that time, but I never got it that time. But today, now I am getting this problem. But we can predict, you understand, at the same time, remember it's the very key. When you predicted, if you don't have, please don't tell him that you will going to get it. Anything, a small problem, if you are right pathway, then you say indirectly precautions to be taken place, not that, so you will going to get this problem that will register 90% of the patients will register in their mind, which causing the problem certainly, because that's giving the signals all the time to the patient that somebody told that problem will going to get it, so he is waiting for that to get it. It's not that, but psychologically will feel that. So that's the reason even the patients, once you understand there is a deficiency, we shouldn't put the word. Handling to the patients is the master key. I am a professor or a buddy's professors. They don't know how to handle the patient, but subject expert is there. But that's the failure for the success for the patient. Isn't it? That's very important. Both the things are important. Some people, Almighty has given you that healing power within you that you can treat the patients, but you don't have the knowledge. Somewhere it is piercing in your heart that something I am doing, it's happening, but the people are happy, but I don't know what I am doing myself. Then eventually you are not good somewhere. You wanted to do better than what you are doing then. Now we understand, just I am giving you as a skeleton and then theoretical part to all of you. So this will be helpful. The corresponding viscera of the three portions. Right? Now all of you take off your watches and then bangles and try to find out the pulse positions where exactly is existing. So very, very imperative this, if you take it to your mind. Now you can look at this. You place like this. First try to analyze where the pulse positions and where the internal organs are existing. Right? Now I try to see, because the whole wrist, the wrist, below the wrist, and there is the radial artery. First you try to find out the radial artery. Where exactly is the radial artery? Are you getting the pulse, all of you? Please comment in the Zoom. Yes. Both the hands, are you feeling the pulse? So in the Zoom, please active all the people so that you can learn something is new. But it's not new if the people who knows they to learn something is the new. Every time is the pulse is the place. I love and amazing. The people studies system of medicine is totally different from the practicals. At the same time, studies are different. I know theoretically everything, but diagnosis I am very poor. In that particular time you are lacking. Diagnosis is the key point where certainly you can find out the solution if you identify the causative factor. This is what you will going to learn today.
So this joint starts from here. This is the...
Yes, exactly. Now we just try to understand about the positions. Later we'll switch over to the practical. But now we understand the entire area of the especially and below the thumb, there is the three positions. In these three positions, we try to understand three divisions, three segments. From here, 1, 2, 3, 4. 4 positions. 4 positions you can see here. So these are the 4 positions. You will get the pulses. Sir, what are the destination from the one finger to other finger? There is no gap in between, but just as a paper. Once you place one paper here, one paper here, one paper here, that is the distance. That means 0.75 inches is equal to the one width of the pulse, or 0.75 chun. Chun is nothing but is the 1 inch. 1 inch is equal to 23 mm. So once we place the finger, right, maximum is this is one finger is 0.75 chun. So you just place like this and then try to identify that particular area. That will be really helpful to identify the first segment to be known as a inch pulse or the tune pulse. This pulse to be known as a tune pulse, right? The second pulse to be known as a Kuan pulse. Kuan means is the gate pulse. That's called as a stelloid process. That's called as a stelloid process. There is a bone. There are the radial stelloid process. There is a ulnar stelloid process. Ulnar is this side, but this is a radial stelloid process, is the prominent bone. So this is one side, the second segment. The third segment to be first, second, third segment to be known as a sh pulse. Sh pulse. So that pulse is the distal pulse of the, so last pulse or the pedal pulse we consider. So the pulse positions can be divided into three segments. The another segment to be known as a Leon pulse. The fourth one is to be known as a Leon pulse. Leon, Leon pulse. But however, 3 is the most crucial and imperative. If we understand about these 3 different positions, at the same time we understand here on the other side 1, 2, 3 positions from here. Now we understand about the 3 plus 3, 4 positions, 6 positions, right and left are different. Now by keeping that in your mind, try to find out the proper locations and then proper internal organs are placing on that particular region. Now I am just lifting my hands above to the sky. Now you understand the first segment to be from the wrist to the down. From wrist, this is the wrist region. From the wrist to the down, you can find the where the crease is there. From the crease to the 1 finger breadth is the depth of that or the width of that. Then you understand that particular division to be known as a upper division. Now this is according to the acupuncture, the whole body divided into 3 segments. One is the heaven, the second one is the human, the third one is the earth. In this perspective, the whole body is divided into heaven, human and then earth. Now we understand from the Shanzang, that is the Ren 17. Ren 17 above, that to be considered as a heaven. Ren 17 to the Chi high, that is Ren 6, to be considered as a human. From the Ren 6 to the K1 to be considered as a earth. I'll repeat once again. From the Ren 17, the point is located in between the chest cavity. So from here to the top of the vertex of the head to be considered as the upper geo or upper segment or the upper cavity of the body. When we understand about the middle geo, that means this is the entire area to be considered as the first segment. From here to here to be considered as the first segment. So what are the organs are located on the chest cavity? Wonderful. Now the lungs are connected on the right side and the heart is connected on the left side. Now if we wanted to analyze the pulses, this right hand is related to the lungs and then left side related to the heart. When the heart is good, you wanted to identify that to be identified by this particular area of this segment, but whereas in this area also used as a tune pulse or the lung pulse, right? So this is one thing, is the upper cavity. Once completed, now we'll come to the second level. The second level from the REN 17, where midway between the two nipples, from the nipples to the navel, that to be considered as a middle geo or the middle pulse. Now what are the organs are located? Right side is the spleen and pancreas is located, left side is the liver is located. But according to the anatomically, but the liver is located on the right side, but according to the Chinese medicine, but the liver according to Pulse Diagnosis, left side liver is located. But there are the numerous concepts are there where the liver predominantly functioning, especially on the left side only. When I take the liver organ concept, that time I will teach you how the liver is connected on the left side. Then we understand about the from the navel, that means is the Tantian. Navel also to be considered as a Tantian. This is as the upper Tantian. This is the lower Tantian. Tantian is the area where the maximum the energy is stored. Where the maximum essence is stored in the particular region, that region is called as that is where there is a Swadhisthana chakra. Manipura chakra, Swadhisthana chakra. Midway between these two, the maximum the inheritance energy is stored in this particular region. Some of the authors also believes that, and the doctors, if we think about from here, take the energy from here and then insert the needle, that having the great effect than the just needling. So therefore think from here and then do the attunement and do some kind of the procedure that will be really fruitful to the patient. So in this way, this particular region is a very imperative. This is the Tantian. From these organs are located is, one is the liver is located, and then spleen and the pancreas, stomach is located on this region. Of course is the gallbladder as well. Right. Now all the organs from the right side, is spleen and then stomach is located here. Spleen and stomach. On the left side, gallbladder and then liver is located on this particular second segment. That segment is known as a Kuan segment. Kuan segment or the gate segment or the central segment or the polycar, which we call as a clusal pulse. Numerous names. Keep it any one name within you. Now the lower portion to be known as the lower cavity to be considered as below the navel and till the foot region, that to be considered as a lower jaw. Then the right side is the kidney yang, whereas in left side is the kidney in. The kidney in and yang are the two different concepts, but here this is the third segment is the kidney yang, this is the kidney in. But the proper kidney, ideal kidney, is really totally different. When the sex problems we wanted to treat, and then the fertility to be treatable by using the right kidney, and then the sex to be treatable by the left kidney, so on. There is some misconceptions are there. But however, the right and the left kidney is the different kidneys, but however, both are equally functioning in